Welcome to Digital Health Talks. Each week, we meet with healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly, no BS deep dive on what's really making an impact in healthcare.
Welcome to Health Impact Live Digital Health Talks. I'm your host, Megan Antonelli, and I have the privilege of speaking with a true innovator in the field of stroke rehab. Our guest, Kristin Nuckols, the co-founder and chief clinical officer of Imago Rehab. Kristin has dedicated her career to improving the lives of stroke survivors through clinical excellence and innovation. Her groundbreaking work has recently earned her the 2024 Innovation Award from the National Board for Certification in Occupational Therapy. Kristin, thank you for joining us. How are you?
Thank you so much for having me.
Absolutely. Well, it's exciting to learn about this. I know we've been working a lot with the American Heart Association, and you guys have been involved with their work as well. But tell me a little bit about your founding story and how you started the organization and got started in occupational therapy.
Sure. So I decided to become an OT when I was 13. And I had a hand injury and went to an occupational therapist, and she made me a splint and did some fun activities with me, and I got better. And I thought, well, that sounds like a good job. And then when I was in school, I began to learn about stroke rehab, and that really became my passion. And for the last almost 18 years, I've been working in this space and trying to make stroke rehab better.
Amazing.
So Imago Rehab was founded out of a Harvard engineering lab. I was working there as a researcher. We were creating wearable robots, which we'll talk about some more in the rest of this conversation. Creating wearable robots, looking at the idea of connected health. What does that mean, connected healthcare? How do we help people? How do we know what they're doing? How do we tell them what to do when we're not with them? So that kind of technical side from Harvard. And then also I completed my post-professional OTD, which is a doctorate in occupational therapy. And I did that, wrote a thesis about how can we serve people with stroke using a telehealth model. And that was written before COVID happened. But then COVID kind of enabled the billing structure. And so we just put everything together and launched a telehealth service with a technology development side.
Oh, wow. So what inspired that thesis?
Really, that's a great question. So I had been working in clinics for about 10 years at that time. And I just had this experience of the patient saying to me, I can do this thing when you're with me, but when I go home, I can't do it. And whether that is the clinic setting is different from their home, the height of the table is different, the layout of the cabinetry is different, all these different activities we try to do with people. Or maybe it's our coaching and our cueing or our hands that are kind of guiding someone's arm or body to do something. And they get home and they go, I can't do that thing that I was supposed to do. Or they get home and say, I don't remember what I was supposed to do, which is sort of answered by this idea of connected healthcare. So how do we prompt them at home? So just those experiences I had with my patients over a decade of working in stroke really inspired me to try to ask the question, how can we make that better? And so what you do, to answer the question is look to the literature. What's been sort of proven by other people to be the best answers to those questions. And so the literature really guided me towards telehealth. And that was, again, a pre-COVID. So there's many, many, many solutions that have come out because of COVID. Oh, we'll just do that over telehealth. Oh, we'll do that. So this was, something that I decided on before it was necessary for, public safety in 2020. And the idea,
and to some degree, because it was better, and because it was needed. So tell us a little bit about what it was, or what, how it works, how the digitization of that works in the home.
Yeah. And this is so unusual. And if you would have told me, 10 years ago when I was working in the clinic in person, that I would do this over a computer, I would have just thought, what are you talking about? This stroke rehab is really, it is hands-on. I have to touch them. I have to use my kind of magical hands to make someone's body function differently. And the literature about telehealth tells us that if you give the same intervention in person or over telehealth, then the patient typically has the same response. So that's part of it, that you can just basically give the same intervention with some benefits, like over telehealth, there tends to be less cancellation because all you have to do is open up your computer to jump on the call. You don't have to drive across town. So that's kind of in the broader spectrum, like maybe musculoskeletal or maybe a little bit simpler conditions, not necessarily stroke or brain injury. Those are very complicated, very complex, and they require specialists. So this is kind of the other nuance of what we do, is that you really can't get stroke therapy at the shop down the street. It's not just the every PT, practice on the corner. It is very specialized, and we, follow kind of the best evidence. We've just synthesized that and put that into our practice. And so we can provide that. You don't have to be right next to us in order to get that. We can take, a therapist who has this skill training that we provide, and they can serve an entire state. So we can serve someone in the panhandle of Florida, and we can serve somebody who lives in the Florida Keys and everywhere in between. And that's just not something that you can do with a kind of a local practice.
Right. So convenience in the home and then access, right? And to some degree, certainly scalability of the specialists, right? And specialists in terms of who, clinicians that are available.
Right.
That's amazing. And then what about the, tell us a little bit about the actual, interface for the patients and how they're, how do they get prescribed this?
Good question. So, we do our therapy sessions just like you and I are talking right now. We use a HIPAA compliant Zoom platform. And it really, I can see into your house. I can see your blue chair. I could see the dog a little while ago. And so we really can customize therapy to your house and your experience and to the things that matter to you. So that part's really important to us. Tell me the other question.
Well, just in terms of how patients get access to it.
Right. Yes. So, we have an intake team. We've built the structure on our side that once somebody finds out about us from, say, our online advertising or from a provider, like a physician who knows about us and will refer, we do the back end. So we will look at their insurance and see if we're in network or out of network. We can work on what's called single case agreements. If we're out of network, we really try to still serve people through their insurance. And if they are in a state that requires referrals, then we make that happen. So, we try to take all the burden away from folks. Their lives are already difficult. So finding healthcare should not be one of the things that's really difficult. But right now it is. So we're trying to just solve as many of those problems as possible. Bringing healthcare to your house, bringing healthcare right onto your computer, using your actual items in your house to become therapeutic to you. And then kind of all those, the business side of things, we try to just smooth all that out for people.
Mm-hmm. And in terms of payment, so insurance does cover it. You have
yes. Yep. Mm-hmm. Yeah. So we're able to just utilize, existing therapy codes. We provide the same services that you would get in clinic. We just provide them virtually. And we're able to bill, Medicare in all the states that we're active. We're open in 7 states. And so we can bill Medicare and then, the top payers in every state.
Amazing. So, because I think that's one of the biggest hurdles for digital health tools and applications is getting coverage, certainly from CMS. So tell us, in order to do that, you must be showing the value. There must be some, evidence based around this. So talk a little bit about, how it's working and the results you're seeing.
Yes, absolutely. And this is kind of the interesting thing. And it was a bit of the gamble in the beginning because, telehealth for people with stroke is not something that other groups are really doing. This was theoretically from my thesis. This is what I thought would happen. And so luckily it is what happens. And over, we're impressed by our own outcomes. But really we expect it now. In the beginning we were like, oh, look at this number is so good every time. And now 2 and 3 years in, we're like, here's what we expect. You're going to make this amazing gain. And it continues for longer than, it's not just the first few months. It's 6 and 7 months. It's longer than that. So we're kind of get into the details here. So we do standardized assessments, just like you you might do in an outpatient clinic. If you are at a place that does really stroke specific care, you might get these. If you're at a clinic that does more general care, you probably won't get these assessments. So we're very, stroke specific. I don't want to get too far into the weeds because it's a little bit complicated, but, we use one of the gold standard assessments for looking at movement following a stroke. And you're looking for a change of basically 6 to 8 points on that test. That means that something is different in your daily life. You can move better. And so you should be able to use your arm better. If we're just talking about kind of the upper limb, that's more my specialty. So we're looking for 6 to 8 points, and our average is above 12. So double what you're looking for. So that means maybe instead of being able to do 5 more activities, you can do 10 or 15 activities that you couldn't do before. So we kind of corroborate those findings with another assessment that looks at how much you use your arm in daily life. And so we also see, double the number you're looking for in that assessment. So people are moving better, and they're using their arm better. And so that is a testament to, people actually carrying over what we recommend to them. If you've ever had therapy, kind of just take a minute to reflect. If you've ever had therapy before for shoulder pain or for something, did they give you a handout of exercises when you left? Right. Mm-hmm. And did you lose them before you got? So that's kind of the standard of care, right? That it's exercise based, and that it's sort of like, here, do this stuff, but I'm not really going to tell you how. And, I won't really know if you do it or not. That's kind of the standard of care. So we're trying to break all those bad habits in the therapy world by really customizing people's home program to them, to their environment, to what they can actually do, to the things that will actually make them better. And that really doesn't involve just sets of exercises. So it's a very different type of therapy. And then we find that it actually works when we do these assessments.
Right. And so is it always a clinician and a patient engaging and interacting, or are there elements of sort of digitized health coaching and things like that?
Yeah, that's a good question. So I would say that more of the digital only is a bit more of like what we're developing and what we see more in the future. Right now, we're all, one-to-one service. And then we have a lot of, I won't call it digital health coaching, but sort of like digital programs that the patients can work off of that really mimic the things that we say and mimic the way that we coach them through these moments. We're sort of still teaching them when they use our home program. So it's, it's not a list of exercises. It's not 10 of this, 10 of this. And that's the way that therapy has been done for decades. So we're really changing how people are experiencing a home program.
Right. And if you think about it, I think about my house, I have 3 flights of stairs, I have this, so that ability to be in the home, to see where these people are, aging in place, if you will, or, rehabbing and what they need to be able to improve their quality of life, which is what it's all about. Right.
Yeah.
That's amazing. And so as you, kind of look at that and, look at your, with that kind of evidence, what are your, sort of expansion plans? You said you're in 7 states, how do we get it in 50?
Yeah, that's a great question. Money is generally the answer to that question, which we've told other people. They think we're kidding, but really that's kind of true. There are costs associated with expansion. So there's certain regulatory documentation. There's, a bit of office presence, a bit of, registration that has to happen. There's time spent, credentialing therapists into that state or credentialing them to a payer. So there are just, systems that are in place for allowing us to expand. And that's something that we've worked really hard on. Something I learned early on about, being in a startup or co-founding a startup is that anything that depends on you personally is not going to work, right? You have to develop a system. So that felt really difficult in the beginning, where a lot of this was just coming out of my head. This is how I treat. This is how I know is the best way to provide this and this and this intervention. So having to document everything and make it trainable and record it. And, so just but creating a system so that the system can scale, because an individual cannot scale. So that's a lot of what we've done. We're also looking to expand into other populations that we can serve. So the kind of therapy model that I talked about is really about behavior change. And so behavior change model can be applied to just about anything, but there are some certain populations like cardiovascular that we're also very interested in making an impact in. These are folks who, the standard of care is going to a cardiac rehab clinic in a hospital. And so you've got to get there, so it's 60 rides back and forth, right? So that can just feel insurmountable. And it is only about 10% of people who are prescribed cardiac rehab actually end up going to all the sessions they're prescribed. So it's just a group with really high drop-off rate. And so if we can make that therapy accessible, convenient, personalized to their home, help them to change behavior in a lot of ways, then that would be really effective as well.
Mm-hmm. Absolutely. Yeah, no, it's super interesting to think about. I mean, and, going back to the neurological, sort of interventions and areas where, getting that access. I mean, one, it's a highly specialized area. Two, the ability to travel and go to these places is that much more challenging. And I think about it in in pediatric cases with, disabilities and things like that, what's possible, around that.
Yeah. If we can, it's not only the person that's getting the therapy, it's also a caregiver. It's also, people are rearranging. We hear it all the time. Let's say we have someone's mother in therapy and the adult child is trying to work from home and they've also got to pick up kids from school, and there's just layers upon layers of complications. So whatever we can do to make this easier for our patients, that's going to really benefit them. And then we hope that the word gets out to other people.
Mm-hmm. And so you mentioned in terms of money, in terms of, we like to focus on female founders and co-founders here at Digital Health Talks. And so tell us a little bit about your experience there, and tell us a little bit about where you guys are in terms of the funding rounds.
Mm-hmm. Yep. So it's been a journey. I'm very glad to have a team that has really celebrated the idea of having a female founding team, and a female driven workforce too. So it's not only just a female founded business, but also I think see if I remember the numbers. 96% of speech therapists are female, 90% of occupational therapists, and 86 or 80 something percent of physical therapists are female. So we do have male therapists on our team as well, but overwhelmingly our workforce is likely to be female. So that's very impactful as well. And something that's very unusual about Imago is that we're offering therapists remote work. That is not something that is usual for people in the therapy field. We have some therapists who just tell us, my body is worn out. You can't tell because I'm, on a video, but I'm 5'1". And so you walk into a hospital room and there's, a guy with either a stroke or say 2 knee replacements or what have you, spinal cord injury, and he's 6'5", and your job is to get him out of bed. So, it's very tough on our bodies. And we just, day after day after day, so year after year. So having a remote option is really exciting. We've watched other people in other what's the word I'm thinking of? We've watched people in other professions be able to switch to remote work. And just previously, that was not something that was available to people in the therapy community. So It's great to be able to offer something different.
Well, it makes me think of 2 conversations I've had recently. I mean, one with, a nurse who, has been working in the field for years and, has so much still more to give, but it's a physically exhausting job, and, sort of that time on your feet and all of that. And where can they then, how can they, she was talking about in the context of virtual nursing. Yeah. Right. We have this incredible staffing crisis that we hear about all the time. Mm-hmm. And yet, we've made it almost, more difficult for them to continue to practice. So that's really interesting. And, certainly in an area that, you don't think about, but, and it's funny. I think about my son who wants to be a physical therapist, who is a very, strong and able-bodied 19-year-old, with big aspirations. But I even, in thinking about him as the generation that he is, which is, as much as he's a tough guy, when he was thinking about, did he want to go intern in a hospital setting versus at like the local PT office, right? So his
what do you want to be exposed to,
Right. His experience with the local PT office is a bunch of athletes who have ACL, whereas when you go into the hospital setting, it's a very different environment. And I was like, you want to go to the office if you really are going to continue in the hospital, much like his mother, right? Much like his mother, he might, end up in events as opposed to being a doctor. So, it's a hard, the environment that you're in, but certainly it doesn't change the expertise or the capabilities. And so that ability to do that, I mean, is great. So that's exciting. Around just your experience as, as you're looking to get more funding, but tell us a little bit about your journey as a female founder, getting investments. You guys have done a great job with your initial rounds, seed round. So tell us a little bit about that, as we have lots of female founders who listen to Digital Health Talks.
Yeah, we have been blessed with very supportive and hardworking investors who are part of our story. We have some venture capital backing, we have angel backing, and so we also have some grant funding that has been helpful for us as well because it's non-dilutive. So we kind of have a variety of funding. And overwhelmingly, people have been very supportive of our team and our expertise. I have close to 20 years of experience in this field. And as we've brought on other team members, they bring decades of experience. So we have a really amazing team who has been able to just, jump into, say, a CEO role and a COO role. So we've brought in just teammates that are fantastic. There's only been kind of one challenging moment as a female founder, where an investor, before we got to pitch to the entire team of 50 white men, told us we don't invest in female founded companies traditionally. And it was like, oh, I think you said the quiet part out loud. But overwhelmingly, people have been very respectful, very complementary to what we're doing. We're innovating, we're bringing something new and fresh. We are an impact investment. So we are, really telling the story of people who get kind of left behind. Stroke is a lifelong condition. So you have a stroke and you survive. And that's really something that is actually changed a lot in the last 15 years. People are surviving strokes they used to die from. And so that is fantastic. They're able to live with their families for years and decades after a stroke, and they're living with way more disability. So that's kind of like a difficult scenario. But so part of what we bring is an impact investment, and our investors can feel wonderful about actually helping to bring just a really necessary and kind of life-giving experience to these people.
Well, that is a story I wish, in terms of the male investor opening his mouth, a story that I wish I didn't hear similar stories often, but I'm glad you are able to persevere and get other funding.
We just look for, there's a lot of fish in the sea, as they say, and if someone isn't comfortable having a female founded business, then we're just not the right partner for them. So
no, right. And that's, I think and one of the things that I've seen through our work with the American Heart Association and the health tech competition that we help with, is how much, of cardiovascular innovation has been centered around male research, right? And that it is such a, so their Women in Red program and all of that stuff is a great program. But certainly it is good to see that there are a number of investors out there who are interested in both funding female-founded businesses, but also funding the research around women's health. And it's at least increasing a little, and the awareness is there, which is good. But, so as we look to the future, we always like to sort of look to the positive and kind of that intersection of digital health and occupational therapy. What are the areas that, you're most excited about, and where you see, the significant, where you're expecting to see significant improvements?
Yeah, it's a great question. So the way we kind of describe Imago Rehab is that we have a telehealth business serving adults with stroke. and other neurologic conditions. And we also have this technology arm where we are, innovating in this space. We're bringing wearable robots into people's homes. We're bringing sensor-based capability where we can, tell people how to move, when to move, where to move, using sensors and wearables, and actually working towards AI models that will help us to provide the best type of therapy and to be able to provide therapy when the therapist is not actually live with the patient. So, boy, the future is going to be exciting, and those are all things that we're working towards. And we're one of the only groups doing that, and that's a great place to be.
Yeah, that's amazing. Yeah, no, we're talking to a lot of folks about, that hospital at home, the aging in place, and all of those opportunities that are there. And it's just exciting. And then I always see it being, being a mom, how it all has applications to pediatrics and children and,
Totally.
and any, that population. It's not just the elderly or the ill who, need this. There's so many applications. So that's so exciting. So tell our audience, thank you so much for being here, Kristin. It's, mind opening to me. I was a biopsychology major. So neurology is like my, I started in Parkinson's and all of that.
Yeah.
So it is my, kind of passion. And so it's just exciting to see the field going in this direction and how much potential there is. But tell our listeners how to, support your mission and get in touch with you, and hopefully, send some funding and support that expansion.
Sure, yeah, we always take funding. So you can just check out our website, which is imagorehab.com. The name Imago, we get a lot of questions about. It's a phase of metamorphosis. So it's actually the phase in metamorphosis when the exoskeleton comes off and then the creature is different. So it's really a reference to our wearable robot, but the idea of change and, really becoming something new after you experience our therapy. So it's imagorehab.com. And if you are looking for our services, you just click contact us, or get started, I think is what the button says. You just click the big button in the corner and our team will reach out. We have an intake team that will reach back out to you in a day. And if you want to contact us for funding, you can just reach out to me. I'm Kristin at imagorehab.com.
Perfect. Well, thanks, Kristin, so much. I look forward to hearing more about all your successes and, hopefully seeing you at future Health Impact and events. But thank you to our audience for listening, and don't hesitate to reach out to Kristin or me with more information, and subscribe below.
Thank you for joining us on Digital Health Talks, where we explore the intersection of healthcare and technology with leaders who are transforming patient care. This episode was brought to you by our valued program partners: Automation Anywhere, revolutionizing healthcare workflows through intelligent automation; Natera, advancing contactless vital signs monitoring; Elite Groups, delivering strategic healthcare IT solutions; SailPoint, securing healthcare identity management and access governance. Your engagement helps drive the future of healthcare innovation. Subscribe to Digital Health Talks on your preferred podcast platform. Share these insights with your network and follow us on LinkedIn for exclusive content and updates. Ready to connect with healthcare technology leaders in person? Join us at the next Health Impact event. Visit healthimpactforum.com for date and registration. Until next time, this is Digital Health Talks, where changemakers come together to fix healthcare.